Welcome to Lifestyle Matters. I'm Marilyn Moore, and we have Dr. Amira here with us from Fresno Surgical Hospital. We're going to be talking all about pain and what you can do to alleviate neck and back pain. Doctor, thanks for joining us.
Oh, you're welcome.
Now, pain, that's a big word. Why don't you describe what is pain management?
Well, pain management is a medical specialty that treats pain, dealing with pain, diagnose the pain, and give the best treatment for the patient.
Now, how do you exactly diagnose pain?
Well, the diagnosis starts with taking what's called a pain history from the patient. Ask the patient a few questions. Talk about like when the patient start having pain, what increasing the pain, what decreasing the pain. It's kind of full history of the patient having pain. Then we go with the physical examination. And after that, we order some radiological examination in the form of CT scan or MRI. And after that, we will have the diagnosis.
And then, what are the different treatments that you offer?
Well, in general, chronic pain patient treated with three options. Either conservative treatment like stretching, exercise, massage, Advil, Aleve, physical therapy, chiropractic, TENS unit, or we go with the second step, which is interventional treatment, some kind of injection, because the third option is surgery. And so this is the three options: conservative, interventional, and surgical treatment.
Now, say somebody comes here and they said, I got back surgery when I was in my 20s. I still deal with chronic pain every day. What's something, and they're in their 40s, so it's been 20 years since they had that surgery. What is something that you would recommend?
Well, first of all, we have to have the diagnosis. Once we have the diagnosis, the treatment will be much easier. So if the patient has like a pinched nerve and failed conserved treatment, we do in the interventional what's called epidural. If the patient has like fracture in her spine, compression fracture, we inject a cement or what's called balloon kyphoplasty. If the patient has spinal stenosis or facet arthropathy, so the treatment will be, again, depends on the diagnosis.
Now, what's your goal with every treatment?
Well, we are looking for three goals. Goal number one is decrease the pain, control the pain, so the patient can increase their activities, starting doing more exercise, start doing like kind of going out, stretching, exercise. And all of this comes after controlling the pain. And the third most important to me is decreasing the pain medication, because all of the pain medication, whether Tylenol, what's called Advil, Aleve, or narcotics, have a significant side effect.
Now, do you really see a positive outcome when somebody comes to you?
Oh, definitely.
Yeah.
They come here, we do some treatment for the interventional treatment, and the patient, most of the patient, I'm not saying everybody, but the majority of the patient, they benefit and they store their normal activities, and they were happy with the outcome of the procedures we do.
Now, what would you say to someone that's been dealing with chronic back pain for a very long time?
Well, number one, we need the patient to continue exercise, because by doing exercise, definitely the study shows they will improve with the pain. Doing no exercise, actually, it's aggravate the pain. So the only advice to the patient is to continue physical activity.
And that's really great anyways. That helps with your overall health as well.
Definitely. It's not only for the pain, but for their brain, for stress and anxiety, even for heart and GI system.
Now, why do you prefer to take your cases on at Fresno Surgical Hospital?
Well, Fresno Surgical Hospital, when it comes to that center, it is the patient care. They provide us with a most talent and qualified nurses. They have good administration that provide us with everything we need to help the patient. And a matter of fact, one of the question to my patient when I do procedure there, how the nurses treat you there, and the majority of the patient, they are happy with the service they receive at the Fresno Surgical Hospital.
That's great. Now, doctor, just a brief, you're very knowledgeable, brief description about, your background a bit.
Well, I finished my medical school in Cairo, Egypt. Then I came to the United States, where I finished my training in anesthesiology, and I did a pain fellowship, interventional pain fellowship in Chicago. Then because of the family reason, I moved to Fresno.
Well, There you go. Well, viewers, if you have any chronic neck or back pain, come see Dr. Amira with the Fresno Surgical Hospital, because clearly he can really help you. He's got a lot of great treatments that he could recommend for you. You're watching Lifestyle Matters. I'm Marilyn Moore.